the food supply in general in the United States is the safest food supply in the world. We have less people get sick and have any kind of diseases associated with the food they eat in the United States than anywhere else in the world. It's illegal to put hormones in chickens. If somebody did, they'd go to jail. Antibiotic usage is extremely highly regulated in the United States, and it's going to become even more so regulated in January of 2017. A veterinarian will have to be involved in the decision to use an antibiotic in a poultry, in pigs, and cattle. They'll have to write a prescription. It won't be any different than you needing an antibiotic for a sinus infection and going to the doctor. So that's going to make it even more, it should make consumers feel even more confident that their food is safe. They don't need to worry about their children picking up any antibiotic-resistant bacteria from eating chicken in the United States. A veterinarian or a farmer can't just go out and grab a drug and use it. It has to be exactly what's been approved by the Food and Drug Administration. Outside the United States, that's very, very different. But in the U.S., it's very highly regulated. We have many less antibiotics approved in the U.S. than anywhere else in the world. Veterinarians, almost every chicken company in the United States has a veterinarian or a consulting veterinarian that they get advice from. Most of the larger companies have their own veterinary staff. Those veterinarians are, their primary role is to prevent disease. A poultry veterinarian is like a public health medical doctor. They're looking at that whole big city and making sure that everybody in that city stays healthy. And that's what a poultry veterinarian does through either vaccination to prevent diseases or through the antibiotic treatment. To help consumers feel more confident that veterinarians are being consulted, the Food and Drug Administration changed the regulations on the use of antibiotics in food animals. And that will begin in January of 2017. And that will require that any antibiotic used in the feed or in the drinking water of a food animal has had a veterinarian sign either a prescription for water or what's called a veterinary feed directive, or a VFD, which is like a prescription for an antibiotic to be put in the feed. So that oversight's really always been there in the poultry industry. It's just now codified in a regulation where a veterinarian has to put their name on the line now, rather than just saying, yes, go ahead, this flock is sick, they need to be treated. They'll have to write a prescription for that to happen.